Hello, I'm Nadia Bilchik. I'm a professional speaker, trainer, and communications consultant. And I speak a lot about presence and leadership presence and your virtual presence. But actually, it all begins with you and confidence and how you feel about yourself. And I have two remarkable physicians with me today who are going to be talking about being well, because being well and healthy is so essential in coming across as the best version of yourself. So I have Dr. Jen Linehan, who is a urological surgeon in Los Angeles, and Dr. Anton Bilchik, who you may remember is my brother, joining me, and he's a cancer surgeon also in Los Angeles. And I really wanted to talk to the two of them about how do we get healthy enough and understand health enough to come across as the best version of ourselves. And Jen, starting with you as a urologic surgeon, what are some things that everybody can do, and it's not an easy topic to discuss, so that we can prevent any urological issues?
So I think one of the first things that I can recommend for patients and for families that are now at home or working from home with COVID is that this is your opportunity to stay hydrated and drink lots of water because you're going to have a bathroom close by. So I think sometimes when we get stressed, we forget to drink just plain good old-fashioned water, which can be very helpful to wash out toxins and to keep bacteria out of both your colon and your bladder. I also think from a urological standpoint that most patients, men and women, would benefit from a cranberry supplement that also helps to keep the bacteria to a minimum within the bladder. And although we don't understand exactly how and why cranberry works, but we think that it helps to shed the bacteria and the toxins from the bladder, which is helpful. So if you're drinking lots of water, taking cranberry pills, I think also adding in vitamin C both is healthy for the bladder and preventing infections, as well as healthy for the body, especially in times of stress where you're making tons of free radicals in your body because of your stress. And the vitamin C can help take care of that and help you tolerate the stress better. And also vitamin D. And we're finding both the vitamin C and the vitamin D are important into helping to lessen also a viral response to COVID. So I think from a urologic standpoint and both a general standpoint, the vitamin C and the vitamin D can be very helpful.
And of course, this is interesting, right? We're here streaming live, and I don't think, certainly to my LinkedIn community, you often are discussing the bladder, but it's terribly important.
Yes. And I think a lot of patients have waited to get proper urologic or surgical care because of COVID. They don't want to go into the hospital. They don't want to be seen. But I think there are some things that you really have to watch out for. And what I tell my patients is that, look, if you have urinary symptoms that are persisting over 3 days and general measures like azo over the counter or NSAIDs or Advil aren't helping you, you probably really need to see a doctor or your primary care and get checked out. And if you see blood in your urine, please also see your physician right away. These are not things that you should sit at home and wait with.
Anton, I'm curious, do you take any cranberry supplements? Do you drink cranberry juice? And do you do vitamin C, vitamin D?
Well, after listening to Dr. Linehan, I'm going to start drinking cranberry juice right now. I was actually looking around in my office to see if I could find any cranberry juice. But
she says cranberry supplements, though. Jane, just clarify for us.
Yeah, so in order to get the benefit, you would have to drink so much non-sugar cranberry juice. It can't have any sugar in it because bacteria love sugar, that it would be like gallons a day. So the supplements 2 or 3 times a day are better.
Got it. Well, I'll look for cranberry supplements. But regarding vitamin C and vitamin D, I think every person is different. If you're healthy and you're eating a balanced diet and exercising and having some exposure to sun, there's probably more than enough vitamin C and vitamin D in your diet already. but not everyone is eating a healthy, balanced diet, and certainly there's benefit to women taking vitamin D and calcium supplements. But what I'm noticing with COVID are really two groups of patients. One group who are clearly just overeating, they've gained a significant amount of weight, and then the other group who are actually losing weight. They're more conscious of what they eat, and they've got more time to think about recipes. And clearly two groups of patients, which I was quite surprised to see, because I really expected most people to be overeating. One of the other concerns is people just drinking too much alcohol.
Yes, they say you're going to emerge either as a drunk, a chunk, or in a funk.
Yes, I like that. Chunk, drunk, or funk.
Yes. But I think interesting speaking to the two of you, because Anton is a cancer surgeon, Jen is a urological surgeon, right? You're a urologist.
Urologist.
But in essence, I mean, both of you are dealing, by the time people get to you, they have severe issues. And I thought it would be so helpful today to discuss how do we prevent getting to a point where we have these severe issues. And Jane, when you say vitamin D, do you believe in a supplement? Obviously, there's certain foods, but do you yourself take a vitamin D supplement?
I do. And like Anton says, most of our supplements that we get from our food, but I think vitamin D is one of the ones we don't often get enough of because of sun exposure. And we're encouraging people in our line of work to wear sunscreen and cover up and not get sun exposure. So I actually take a 5,000 units 3 times a week. You don't need a lot, but that's plenty. And again, I think there are other benefits to the vitamin D.
Does it ever make you itchy? Because some of the things people say is too much vitamin D actually makes you itchy. Have you ever heard that?
I've heard itchy, I've heard constipated, I've heard dry mouth, and I'm never sure if it's related particularly to the vitamin D. I don't know, Anton, if that's a myth that the vitamin D causes constipation. That's why I tell patients just to take it 3 times a week. You don't need to take it every day.
Yeah, I agree with that.
So the other thing that's been very topical this week is Donald Trump testing COVID positive, being released from hospital very quickly, talking about herd immunity. Help unpack this for us.
So I think the herd immunity is interesting to me because I recently learned that herd immunity really is a term that applies to a population that has had a vaccine and then develops immunity, not necessarily because you get it, develops immunity. So, I mean, we definitely will at some point have some herd immunity when we get a vaccine. How well the vaccines will work, I think, is going to remain to be seen. But I think Donald Trump is very lucky to have been out of the hospital as early as he was. And I think he should still be encouraging, wearing masks and washing hands, given the fact that he himself got sick.
Yes, and just to add to that, the concern that we have is, he says that he's immune to COVID because he was infected by the virus, and we really don't know that. We don't know how long he's immune. But something else that I think is really important in understanding immunity that we're also now learning is that if you receive this antibody cocktail that he received, that may be very effective in the acute phase, that may actually reduce your long-term immunity to COVID.
So a couple of questions are coming in. They're a bit random and out there. So Jen, starting with you, question is, how many cranberry pills should you take? And do you have a specific brand that you endorse?
So it's not necessarily about the number of pills that you take, but that you're taking the medicine frequently throughout the day to keep it within the urinary stream. So if you have a prescription or if you have a supplement at home, then I would take 1 to 2 of those pills at least 3 times a day, morning, noon, and night. There is a brand I like that's called Elura, only because it's a 24-hour cranberry pill, meaning that you don't have to take it multiple times, and it's time release, so it stays in your urine.
Okay, and then someone on Facebook is asking, what about, thank you for all of you who are bearing with us. I'm talking to Dr. Jennifer Linehan, who's a urologist in Santa Monica, California, and Dr. Anton Bilchik, who is a surgical oncologist, and my brother. And we're talking about prevention, cure, COVID. Questions are coming in. The other question was, do Kegel exercises work? And you might want to explain what those are.
Yes, so some patients after having hysterectomy or after having babies will have leakage. Men can also have it too after having certain surgeries where they leak urine with activity or leak urine with cough and sneeze. In those cases, when that is specifically occurring with leakage with activity or leak with cough, sneeze, laughing, the Kegel exercises definitely will help. What I teach patients is do not overdo it. 20 to 30 Kegels a day, that's all you need. If you do too many, you can actually fatigue the muscles. And basically a Kegel exercise is holding in your urine. It's the sensation of holding in the urine. And you're going to not do that when you're trying to actually pee, but do that at home in a quiet space. Try to hold in those muscles, count to 10, and then release. And again, you only need to do that 20 times a day.
I promised you very practical advice here. Anton, question for you that's come up is for your patients, obviously anesthetic sometimes causes one to not urinate. Do you release patients before they urinate? Do you wait until they are urinating? What do patients need to know?
Yes, so we struggle with this quite a bit. I just did a couple surgeries this morning on males, and after surgery, it's not uncommon, particularly in males with a slightly big prostate, for the prostate to go into spasm. And there's nothing more frustrating than sending people home and then they can't pee, and then you're having to bring them back to the emergency room and have catheters placed. And so I'd be very interested in what Dr. Linehan has to say for all the males out there that are having outpatient surgeries. What can be done if they can't pee immediately after a procedure?
Well, I think especially for Dr. Bilchik, for your patients, when you're doing some complex surgeries or hernia surgeries, those are associated with some risks of urinary retention. We're actually doing a trial here where we're using medicines called alpha blockers. Some patients notice Flomax or Tamsulosin or Rapaflo. There's several different of them, and giving that to them in about almost a double dose right after their surgery, especially if they're known to have a big prostate, so that they don't have any difficulty voiding. But if you are having an outpatient surgery, it's really important to make sure that you empty your bladder and that you know you are peeing before you leave the hospital.
So a question that we get asked all the time is, we get a call from the nurse saying, well, the patient hasn't peed yet. Can they go home? Should we tell the nurse that the patient needs to stay longer, or to drink lots of fluids? This is
because clearly what happens is during the anesthetic, part of the bladder is anesthetized, correct?
Yes, it becomes a little lazy and sleepy and becomes more relaxed and is holding urine instead of giving a nice squeeze when it needs to, which is more important in men than in women. Women, we pee essentially by gravity. We relax our pelvic floor, pee comes out. Men actually have to generate a push.
This is a very, not an easy discussion to have, I know, but very helpful, very useful as we all navigate a particularly stressful time where so many of the issues are exacerbated by stress. And so something you've said in our last discussion is you are seeing more cancers.
Yes, we're seeing a lot more cancers in younger people, especially colorectal cancer. And not just a small increase, a massive increase. So people under age 50, we're seeing about a 5 to 6-fold increase, basically seeing about one patient a week who's under age 50. So the incidence has gone up enormously, and the mortality or death rates, particularly in African Americans, is higher than Caucasians.
Why is that?
And we just don't know. So there's a lot of work that's going on right now to better understand why there's such a massive increase. One of the challenges is that colon cancer is mostly detected by colonoscopies. Colonoscopies are usually recommended starting age 50, and most insurance companies will only pay for a colonoscopy at age 50, even though the American Cancer Society has reduced the screening age to age 45 and even to age 40 among African Americans. So we're seeing this really big increase in young people, and it's a really major concern to us right now.
So what would you say, Jen, for you, your major concern is? And then again, for all of us who are consumers of medicine, I mean, we're on the other side, we're the patient. What do we need to know? And Elizabeth Cohen, one of my CNN colleagues, wrote a book called The Empowered Patient. And I think part of what we're doing today is empowering the patient so that you understand more.
Right. So I feel that I try to give my patients educated websites. So I have certain websites for each cancer, for each disease topic that I will point them to. And I'm like, look, I know you're going to go out there and you're going to want to Google everything, but here's where I need you to go because this is a respectable site. Or I will give them handouts basically with the information that I tell them that is verified in research studies and randomized trials so that they understand what's going on and how we're treating them. But I think that patients have to be very involved in their own care and willing to understand, not that the doctor is doing something, but why the doctor is doing something too. And it's hard on our end because sometimes it does take a little longer to explain. But I think when people understand, their overall health is better because they get with the program.
But you bring up such an important point. Studies have been done that so-called fake news or false news travels so much further and quicker than real news. So there's so much out there. And are you going to a legitimate source when you Google? Are you randomly Googling? And I think that's, does it frustrate you, Anton, that patients will look up their condition and come to you with a whole lot of information?
Oh my gosh, you have no idea how it frustrates me. And I'm so glad that Dr. Linehan brought this up, the so-called Dr. Google. I mean, there've even been studies done by Harvard suggesting that up to 70% of what people look up regarding themselves is actually inaccurate or false. So let me just give you a very specific example. And this is what happened to me on Tuesday. So a patient has a pancreas cyst, a simple cyst that's just picked up because they're getting an x-ray for something else. First thing they do is they go on Google and they look up cyst. Cyst leads them to cancer. Cancer leads them down this very dark road of survivals of only 12 months and maybe even less. Major anxiety, major frustration, and all it is a simple cyst, which we don't even need to operate on. We can just observe. It doesn't change survival at all. So there's no stopping patients from Googling. Most Google what they have before they come in to see you. But I just think Dr. Linehan brings up such an important point. There are really responsible sites that you can read, but a large percentage lead patients down really the wrong path.
I think this is so helpful, and the questions are coming in, some of which you'll have to answer the next time. But the bottom line is, and we discussed this last time, but a question has come in around COVID related, so thanks for bearing with me, is it safe to go to restaurants and eat outside? Quick answer from both of you. And then we'll wrap it up with, we're now in October. What are your Thanksgiving plans? And just any other final tips, advice, or guidance you have for us to become empowered patients.
So I would say, yes, it's safe to eat at restaurants as long as you're more than 6 feet away from the next table.
And I would say you should eat at restaurants outside just to give yourself some semblance of normality, because most restaurants are safe. Waiters are wearing masks and people are distancing.
Okay, and final question is, what advice or guidance do you have about a safe mask? Like, are there masks that are useful? What should we be doing with our masks?
Yeah, hold on, I was going to get mine too.
Oh, good. Thank you both. Okay, we may not have access to yours, so where do we get them? And what's
this is the classic N95.
Yes.
Okay, this is the N95. So this is the one that really should be
mandatory,
reserved for healthcare professionals or people in high risk, because there's actually believe it or not, still a shortage of these N95s.
Are you so okay? But for those of us, is it fine to just put on our paper mask? Is there a good
any mask that you have is good, but I think what I was going to say, if you're traveling on the airplane,
yes.
I like these KN95. They're soft.
Where do you get those?
You can actually buy them in the airport, and they are verified. Actually, in and online too. I mean, not this particular brand. There's several brands, but these are the ones that are verified.
And what are those called?
These are the KN95. This company was called Life.
But that's important, because I think people are traveling, think, well, if they just put on anything, I mean, if you're going to wear a mask, make sure that it's a safe mask.
Yeah, so Jen just brought up something, again, another really important point, because that KN95 is much better than just wearing kind of a scarf or even a paper mask.
Thank you for letting us know.
Some people, and there's even some suggestion that it may even be as effective as the N95, which is the more uncomfortable one that healthcare workers have to wear.
And there's still a shortage of those. Ladies and gentlemen, there are not many shows where we can go from kegel exercises and irregular urination to K95 or KN95 masks, but we can do it right here on Nadia Speaks. So any last thoughts, Dr. Linehan, Dr. Bilchik, and I look forward to having you back, because we have covered a lot and answered many of our participants' questions.
No, thank you very much for the time. I appreciate it. Had fun.
Okay, cranberry pills.
Cranberry pills, lots of water, keep yourself hydrated, and vitamin D.
And KN95. Anton, last thoughts.
Don't stay home. Go out. Be safe. Exercise. Go to outdoor restaurants.
Thank you all so much. I'm Nadia Bilchik. My website is Nadia Speaks, and my goal is to make you think about things that make you healthy mentally and physically. And I've certainly got tips right now. I'm about to go and order my Life KN95 mask and some cranberry pills. Thank you both so much. I look forward to our update in the next couple of weeks.
Thanks.